Asymptomatic ureteric calculi. This was a case report of a patient who underwent an open hysterectomy. Upon opening the pelvis, it was found that the pelvis was what was known as a frozen pelvis, i.e. it was grade 4 endometriosis with significant adhesions. It was difficult to isolate the ureters, and the urologist assisted with the case by attempting to introduce stents into the ureters so that they could be isolated throughout the procedure. There was difficulty cannulating the right ureter, therefore contrast was injected into the ureter and the screening guidance, and as the contrast went in, although it bypassed this area, these appearances were consistent with multiple filling defects within the mid-right ureter, consistent with multiple calculi, radiodense calculi within that ureter, prior or proximal to a kink, essentially. Proximal to this, the renal pelvis and the pelvic calyceal systems were dilated. Prospectively, when the patient was interviewed prior to the operation, they did not report any urinary symptoms, and when asked specifically in retrospect, again, they did not report any particular symptoms such as pain or symptoms of colic, but there was evidence of hematuria on dipstick. In summary, this was a case of asymptomatic urinary calculi, which and the ureteric calculi can be asymptomatic in up to 1.8% of cases of ureteric calculi.